Fix lumbar lordosis and disc herniation fast. You want to get leg pain relief without surgery. If your MRI or X-ray showed a disc herniation and a loss of the normal curve in your lower back, you're dealing with leg pain that just won't let up. There's a major piece of the puzzle that most doctors, most chiropractors, most physical therapists completely miss. In this video, I'm going to show you what it is and what you can start doing about it right now. You're probably frustrated with hearing the same advice again and again. Rest, take some pills, give it time. While your back stays stiff, your leg aches, and nothing ever really improves. Before I get to the main part of this video, let me show something that can actually help you feel some relief right now. It's a simple movement I use with patients with decompression and a flattened low back curve, and it only takes about 5 minutes. Let's look at it right now. This is my favorite lumbar extension exercise. It's great for disc problems. It gives you a little bit of a traction feeling. You're going to need a thick band. Now, where can you get these bands? There's a lot of places. Rogue Fitness has these great big thick bands. Again, you can't use a thin band. You need something strong. You need to make sure it's attached to the wall safely. But I'm telling you, it feels great. Put this right around the small of your back. Now, the very smallest part of your back is right around L5. You're going to create some tension. It should feel good. This feels actually very good to me. And you're going to tighten your butt and lean back. Hang out about 10 to 20 seconds, and I would do 10 to 20 reps. So again, now if you want to play with it and move it up a little bit, so if you go up an inch or two above the belt line, you're right around L4, L3, move back till you get some tension. This feels good. And if you angle it up a little bit, you're kind of tractioning your spine a little bit. So this both is great for lumbar extension, it's great for increasing the curve, and it's great for a disc herniation where you feel better in extension or leaning back. Go back. You decide how far to go back. Hang out about 10 seconds, and then relax. And then play with a few different areas of the spine and say which part gives you the most relief. Remember, don't do anything that causes leg pain, and find the area, find the exact amount of tension that you do. Now, if you don't have a band, what can you do immediately? Without the band, put your hands on the small of your back, tighten your stomach, tighten your butt, push into your back and lean back. Do that several times a day. Again, I recommend go to Rogue Fitness, get these thick power of their monster bands. These are a great addition to lumbar extension for a disc problem that improves when you lean back or in an extension. Now, that's my favorite exercise to give you relief while you're in the standing position. Again, you could do it with or without a band. Now, there are two powerful non-surgical treatments I use in my clinic that go way beyond temporary relief. These treatments are designed to correct the problem at its source, targeting both the disc injury and the loss of lumbar curve with precision. Keep watching, because understanding how these work could help you avoid surgery and finally get long-term pain relief. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and certification in chiropractic BioPhysics. I specialize in treating chronic problems. I'm an old guy, so most of the problems I treat are chronic, like chronic whiplash, chronic L4, L5 disc herniations, chronic peripheral neuropathy, chronic knee problems. Basically, I specialize in helping you live stronger, longer, dealing with the most common problems that plague man as we walk upright. Now, I use a variety of methods that are non-surgical and non-drug, such as corrective exercise, spinal decompression, targeted exercises, and the CBP, or Chiropractic BioPhysics protocol of exercise, adjustments, and traction. Now, before I continue this video, you know what to do. Help us out here. Hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, and stabilize your spine. And the whole purpose of this is so you can live stronger, longer, and enjoy what you do. Now, what makes this two-step method so beneficial that it uses two proven and research-backed non-surgical treatment that do more than just temporarily reduce pain. They are designed to relieve disc herniations, reduce nerve compression, and at the same time help restore the natural lumbar curve. This is key because most treatments only focus on symptoms. But when you correct the alignment and reduce that pressure at the source, the results are much more long-lasting. Again, many things can feel better in 6 weeks. It's really how you doing at 12 weeks, at 24 weeks, at a year. In a moment, I'm going to show you exactly what these two non-surgical methods are and how they work together to fix the problem at its root. Now, the first phase of anyone's care is pain relief. Listen, I've had a herniated disc. I've had to be on drugs. I've had to lie face down over a football. And you know what? We all want to get out of pain fast. So that's our first goal. So the first thing we start with a pain relief protocol to calm the inflammation. Some of you can use natural methods. Some of you might need to do some anti-inflammatories. Again, most people can get by with the natural method. Now, once the pain is tolerable, now that depends. Some people, we can start spinal decompression day one. If that gives you relief, fantastic. Now, I couldn't do that. I needed a few days to let things calm down. So some of you might need to ice a couple days in bed. But the majority of the people that I see, we start with spinal decompression. And what we want to do is we want a computer-controlled table that gently stretches and pumps and decompresses the spine in a very targeted way. Think of decompression as a pump, all right? And it's designed to reduce the pressure inside the disc space at L4, L5, or L5, S1. Those are the most common areas of disc herniations, and that's exactly what I had. It creates a negative pressure, like a vacuum within the disc. Now, this negative pressure pulls, it literally pulls some of the bulging or herniations back within the disc. And I'll show you in a moment on a model. This pulls, again, the bulges. It also increases the nutrient-rich fluid exchange, like a sponge. This is super important to disc repair, disc healing, and to eliminate that pain. Now, general traction is a constant pull. This is not the same. Traction we use to reshape the spine. The tension is constant. With decompression, it pulls, it relaxes. It pulls and it relaxes. It has a computer on it, and we can program it for different settings, different body weights. How inflamed are you? How long is the pull? That's all personalized. So again, traction is static. Decompression is a pumping mechanism with a computer chip that responds to you. It calibrates to your spine in real time. And then one of the things is that when it pumps and relaxes, it relieves pressure and allows the muscles to relax. Otherwise, if you have constant tension, you get muscle guarding, and that prevents the negative disc pressure. So just hanging upside down, or you see people do body weight things, those are stretches. And yes, they're comfortable, but it's not the same. You need a pumping mechanism. You need something to pull and relax, pull and relax. Without that, you get muscle guarding. And if you have muscle guarding, you're not going to get that fluid exchange, okay? Now, the other thing is that sometimes decompression is immediate. Some people feel immediate leg pain relief during the first session. Now, each session lasts approximately 15 minutes. Most patients begin to feel relief within the first couple weeks, sometimes the first day. It's important to be consistent and complete the full protocol for your best results. Once pain is stabilized enough through initial care and inflammation is down, now what we start to do is we start to work on correction. So usually within 2 to 4 weeks, we can start working on correcting the spine. Again, it depends on each severity. Now, some people I'll see twice a week, some people I might see 3 times a week. Everybody's different, and if you're in absolute agony, we might see you 4 times that first week. So it depends when you start. Now, when the leg pain has started to centralize, that means the pain's, let's say the pain's down to your knee, now the pain is getting up to your thigh or closer to your butt. Now we can start to move into what we call corrective care. And again, everybody is different, but as a rule of thumb, we will test you. So if we do an exercise or a traction that puts you in extension and it's not comfortable, that means you're not ready yet. So everything is to your tolerance. And that's where we bring in chiropractic biophysics or corrective care. Because remember, there's a reason that disc herniated. And many times it's because the spine is misaligned. And when that spine is misaligned, the load, the pressure, the force is uneven or even greater on that disc. So if you don't change the cause of that disc herniation, many times that spinal decompression is temporary relief. And I see other people that all they had done was decompression and their problems come back. So we need to address the root cause along with using the miraculous technology of non-surgical decompression. So when you marry the two, I think you get the best results. So this is where we focus on restoring the alignment, especially the lost lumbar curve, and also what we talk about is if you have any shift in your ribcage, we address that. Now, chiropractic biophysics, or CBP for short, is the most researched, results-driven technique for spinal alignment or spinal correction. What we do is we use advanced protocols to reshape the spinal alignment based on everybody's x-ray. It's not about cracking your back for temporary relief. It's about making a structural change over time as evident by an x-ray. A normal lumbar curve helps distribute the weight and protects the disc from future injury. When you lose that lumbar curve, the pressure on the disc increases. Not good. That accelerates degeneration, that weakens the disc and sets the stage for the disc to bulge, eventually herniate, and then sometimes degenerate. Now, CBP combines a mirror image adjustment, mirror image exercise, and mirror image traction in the correction. Mirror image means the opposite of your posture. So if your rib cage is shifted right, guess what we do? We shift left. It's that simple. Okay. One of the key tools is lumbar extension traction. That's designed to restore the natural curve of the lower back. Now, this process is gradual, but each session builds towards measurable change. CBP care is customized based on your own x-rays and your age and the amount of degeneration, and progress is tracked through an updated x-ray, usually within 3 months, to see measurable improvements in the structure. Now, every day we're talking about your ability to move. Every day we talk about your pain relief. So we do mini checks throughout the time. We're looking at movement, we're looking at strength, and we're looking at pain relief. Also, many of the patients, if you see some of the testimonies we have posted, almost everybody's able to reduce the amount of what we call pain meds, and that's a huge factor. Now, correcting spinal alignment helps risk the reduce of future disc problems and nerve compression because we're aligning the spine, taking load off. It's really about pressure and load on the disc. It also improves your posture, your core function, and the stability of the spine. Most people begin with a 12-week program of care, then move into something called a strengthening or wellness phase. CBP is ideal for patients who want a long-term solution and not just short-term pain relief. It transforms the spine from unstable and vulnerable to strong, stable, functioning, and long-term pain relief. If we combine spinal decompression and CBP, that gives the patients the best chance for recovery and long-term disc health. This is how we help patients not only feel better, but actually fix the root problem and protect the spine for the future. If you're dealing with disc herniation and loss of lumbar curve, just know that it is possible to feel better and rebuild your spine without surgery. These 2 steps, decompression and corrective care, are what I use every day in my practice to help patients not only get out of pain, but fix the problem at its source. They're safe, they're effective, and it's tailored to your spine. Now, if you found this video valuable, do me a favor, like it and share it with someone who needs it. Subscribe if you want to learn everything you need to know about healing your spine naturally, without drugs, without surgery. This channel is your go-to resource for lasting spinal health and recovery so you can live longer, stronger. Now, the next video you should watch is this one. I'm going to show you the CBP technique in action and how we begin to correct loss of lumbar lordosis, also called straightening of the lumbar spine or flat back syndrome. Go watch this next video now.